Hello? Discussing first aid is indeed important. Having the knowledge to respond correctly and promptly in emergencies can save lives. We should keep ourselves prepared for such situations. Your interventions can make a difference and potentially save someone's life. Encouraging people to subscribe to the channel before moving on to the video is a good practice. Before transitioning to the video, don't forget to subscribe to the channel. ABC represents the basic sequence in first aid interventions, where attention is given to three main elements in alphabetical order: A for airway, B for breathing, and C for circulation. A. Airway. First, assess the airway of the injured or ill person. Take necessary actions to clear a blocked airway due to choking, difficulty in breathing, or the presence of a foreign object. This step is critically important to ensure proper breathing. B. Breathing. After ensuring the airway is clear, assess the person's breathing. If the person is not breathing or experiencing difficulty in breathing, initiate appropriate respiratory interventions such as CPR, cardiopulmonary resuscitation. C. Circulation. Once normal breathing is established or respiratory interventions have begun, check the person's circulation. Evaluate heart rate and pulse. If circulation has stopped or is weak, start interventions such as CPR to provide chest compressions. Now, taking these into consideration, let's talk about what we should do in the situations we encounter. 1. What is the Heimlich maneuver and how is it done? Why it's done. Choking can occur when a person's airway is blocked by a foreign object. In such a situation, the person cannot breathe normally, and prompt intervention is necessary. The Heimlich maneuver aims to dislodge the obstructing object, allowing the person to breathe again. This maneuver is crucial in choking emergencies and is intended to quickly open the airway. How it's done. The Heimlich maneuver is performed by standing behind the person and encircling their waist. Here are step-by-step instructions on how to perform the Heimlich maneuver. Approach the person. Stand behind the person who is choking and position yourself to encircle their waist. Form a fist. Form a fist with your hand and place it between the person's navel and lower ribs. Cover with the other hand. Place your other hand on top of the fist and hold tightly. Apply pressure. Apply a quick and forceful pressure towards the person's abdomen. This pressure is a compression movement intended to force the obstruction out. Repetitive movements. Continue applying these pressures repetitively if the obstruction persists. However, assess the situation between each pressure. If unconsciousness occurs, if the person loses consciousness, immediately call for professional help and begin CPR, cardiopulmonary resuscitation. It's important to receive training in the Heimlich maneuver to perform these techniques correctly. Additionally, professional help should be sought immediately in case of an emergency. 2. First aid application for injuries and fractures. Fractures limit movement. Instruct the person not to move. Further movement can worsen the situation. Immobilize the injured area. If possible, use a splint or a board to immobilize the fractured area. If these are not available, use cushions, clothing, or other suitable materials to minimize the person's movement. Apply cold compress. Apply a cold compress to the fractured area to reduce swelling and pain. Ensure that ice does not directly contact the skin. Seek professional help. Call for professional assistance immediately in cases of fractures. Dial 911 to notify emergency medical teams and await expert intervention. Injuries, ensure safety. Prioritize the safety of both the injured person and yourself. If there is a danger, eliminate it first. Control bleeding. If there is bleeding, apply pressure to the injured area using a clean cloth or bandage. Place a sterile gauze pad over the wound and tightly wrap a bandage around it. Keep the injured area elevated. Elevate the injured area above heart level if possible. This can reduce blood circulation and help control bleeding. Apply cold compress. Apply a cold compress to the injured area to reduce swelling. Ensure that the ice does not directly contact the skin. Seek professional help. In cases of injuries, it is crucial to obtain professional assistance. Call 911 to notify emergency medical teams and await expert intervention. Every situation is unique, and professional help is always crucial. These steps are intended to intervene in emergencies and stabilize the condition of the injured person. Obtaining first aid training can help you deal more effectively with such situations. What is the recovery position and when is it administered? The recovery position is an initial aid posture applied when an individual loses consciousness. This position is designed to safeguard the person's airway and facilitate breathing. The recovery position is commonly administered in the following situations. Unconscious individuals. When encountering an unconscious person, the recovery position can be applied. Those who have lost consciousness may have difficulty breathing on their own. Individuals with respiratory issues. It can be administered to individuals experiencing difficulty breathing or respiratory problems. In such cases, the recovery position can ease breathing. Injured or ill individuals. It can be applied to those who have experienced trauma, injuries, or suddenly fallen ill, especially if they have lost consciousness. How to administer the recovery position. Approach the person. Approach the unconscious person and survey the surroundings. Once safety is ensured, transition to the recovery position. Straighten the arms. Straighten the person's arms parallel to their body. Lift the legs. Bend the person's legs at the knees and keep the feet flat. Then slowly lift the legs upward, bending the knees. Turn the head to the side. Gently turn the person's head to one side. This is crucial for airway management and prevents airway blockage in case of vomiting. Observation and call for help. Carefully observe the person in the recovery position. Immediately call for professional help, dial 112 or emergency services, and await expert intervention. The recovery position is a commonly used first aid technique for individuals with impaired consciousness, emphasizing the significance of airway control. However, before administering this position, professional help should be summoned, and familiarity with the individual's condition is crucial. Yes, today I talked about a few first aid interventions. I hope it has been helpful. Remember, this is an informative video. Don't forget to get training for better intervention. You never know, the person whose life you might save could be very close to you. Stay healthy.